Hi, I'm Kevin Buck. This is my wife Priscilla Buck, and together we own and operate Care Patrol of Northeast Ohio. Today we're going to review elder care options and how to pay for them, and then explain how Care Patrol can help you through and understand these options and better assist your family as you age. On this topic of elder care options and how to pay for them, the first thing we review with families is what options are available to them and their loved ones as mom or dad or grandma or the aunt or uncle ages. The first one is what we refer to as adult daycare. That's a community-based care organization usually established to take care of a loved one from the hours of 8 in the morning till 5 in the afternoon. Lunches are provided, activities are provided, and for a flat daily fee, you know that there's activities and events for your loved one. Next is respite care. Respite care is when an adult senior lives with their children, or they live close by to their children and the children are responsible for their care, but they're going to be on vacation. What do we do with mom or grandmom while we're away? Respite care allows that individual to go into an assisted living community for a temporary time frame, usually 2, 3, or 4 weeks, and live in the safety of assisted living, but only there temporarily until the loved one returns from vacation. Then we have independent living. Independent living is when a family member goes into a community. Mom or dad is into a community that's safe. You usually enter through a front door and all the apartments are inside. Very independent, 1 or 2 bedroom, have your own kitchen, 2 meals provided a day. But you're in a community that has activities, events, and you're well taken care of, and you have others to keep an eye on you while you're out of the elements, not having to shell off a driveway, worry about snow, and those challenges that people face as they age. Then we have assisted living. Assisted living in many ways is like independent living. The apartments are smaller, but the added plus to this is now the individual gets additional care needs. They're referred to as ADLs, activities of daily living. So if a person needs help with a shower, they need help reminding to take their medication, need help dressing, all their meals are provided for, all those care needs are provided for, and a person can stay in an assisted living facility really for the rest of their life. Then there's assisted living memory care. That's for people that have been diagnosed typically with Alzheimer's or other memory care diseases, and they can live in a community that allows them to wander, be safe in an environment where they can't escape or exit seek, and their needs are being taken care of with others who have similar needs as well. Then you have in-home care. That's where a family decides, I'm going to keep mom or dad with me, and I'm going to bring in-home care into the home. So what you hire is an outside care agency that provides non-medical in-home care, and they can come into your home and do cooking, they can do shopping, companionship, light housekeeping, all those things that kind of challenge a senior as they age. Also, a family member can say, I'm not going to hire anybody, I'm just going to do it myself. The very last option we've all heard, and that is called a long-term care or a nursing home. This is where a person can go into a long-term care facility. Usually they have high needs, high expectations as far as their care level, and a nursing home can take care of a person for the rest of their life. One of the challenges that families are faced with is how do you pay for this? And it's very expensive. And the first thing that happens when they hear the cost, it really is overwhelming. For example, adult daycare costs between $50 and $80 per day. Respite care usually runs between $150 and $175 per day. Assisted living and independent living are fairly similar. Assisted living requires less attention. That usually runs about $2,000 to $3,000 a month. Assisted living usually runs around $3,000 to $5,000 per month. Assisted living memory care, because of the high needs of the individuals there, usually runs between $4,500 and $6,000 a month. In-home care, when you bring someone into your home, usually costs about $20 an hour. And then lastly, you have a skilled nursing care, long-term care. That usually ranges between $8,000 to $12,000 a month. The numbers I just mentioned are really staggering and overwhelming, and many of which I mentioned are just for a day. How does one pay for this? The first one is private pay. People use their Social Security, their savings, their annuities, their trust funds, all those things. If they have it, then they can use this money for their care. The next one we talk about really is long-term care insurance. Long-term care insurance was in the vogue maybe 10, 12, 15 years ago. Not quite as popular today because the insurance companies have made some adjustments, but still a very good option. And the long-term care insurance, if you buy it, typically provides care for 3 to 5 years or until a lump sum of dollars has been used up. Then there's also what's called a reverse mortgage. A lot of advertisements seen on TV about reverse mortgages, lots of varying opinions. Is it good? Is it safe? Reverse mortgages is good in the right condition. They are backed by the federal government, and so you can get money out of your house. All those years you paid a mortgage, now your house can pay you back, and that money is not due to be paid back until the house is vacated or until the individual living in the house passes away. There's another program also provided by the federal government called Veterans Aid and Attendance. This is a program that provides money to veterans and spouses of veterans who served during a time of war. We're now working with veterans of World War II, the Korean War, and some veterans that actually served in the Vietnam War. This program is designed for those individuals who have served at least one day of active duty during a time of war, and can provide the veteran themselves up to about $1,800 a month, and the spouse of a veteran about $1,100 a month if you meet the requirements that are expected. Then there's early cash-in of life insurance policies. Most people have insurance policies. Some are of a higher value, some are lower. Those that are of a higher value can use what's called an early cash-in value, where you can cash it back in with the insurance company. They usually pay about 10%, so that's not a great option. But you can also sell them on the open market, and there's a process to do that. It's totally legal, and you can usually get up to about 60 to 65% of the face value of that insurance policy. And the last one, people often ask me, what do we do if we have limited money or actually no money? And there are options for people that have limited or no money. And that option is what is afforded by Medicaid. Medicaid is a federal program provided by the government for those that have limited funds, and people on Medicaid have a choice, not a great one, it's the only choice they really have, but that's to move into a long-term care nursing facility. That's what Medicaid covers. People say, what about the role of Medicare? And it's good for them to understand that Medicare is a provider of insurance and health care coverage. Medicare only provides for rehab time after a hospital stay, but does not cover any care in a long-term care facility whatsoever. So people with limited funds, their choice that they have is to move into a long-term care place, and Medicaid pays their bill. For families that have some assets, some money, not unending amounts of assets, but they do have limited funds available, mom or dad is saved a certain amount of money, can they use that? So what happens, there are assisted living communities in Northeast Ohio that accept a program called the Medicaid Waiver Program. If you come and spend your private pay assets down with them for a period of 12, 24, or 36 months, depending on what their expectations are, if you spend your assets down with them, once your money is gone, they will allow you to continue to live with them, and they will accept what's called the Medicaid waiver. The Medicaid waiver is, again, a federally funded program for assisted living for those families that have met the criteria and privately spent down their assets. So people with some assets have a choice, and that is they could go in a long-term care nursing facility, or they could spend down their assets and stay in an assisted living facility. People with no assets, no funds whatsoever, the only option they have really is a long-term care nursing home. Just some final things we like to review with families to be aware of as they go through this aging process. And the first one is power of attorney, or POA. Oftentimes people think if I assign a POA to someone, I lose my ability to make decisions, which is not true. As long as you are capable and responsible, you can make your own decisions right to the very end of life. A power of attorney is established so should you be rendered unconscious or have had a stroke or a heart attack and can't make decisions, that person you have assigned as your power of attorney can make those decisions for you. So it's very important that you have assigned a power of attorney, typically someone within the town in which you live in, maybe a family member, maybe a son or a daughter that live close by, that should something happen, they can be at your bedside making the right decisions for you as you have laid out by your power of attorney wishes. The next thing that's very important for families is to make sure and ensure they have a will. Most individuals have gotten a will as they get into the later stages of their life, and that is important, but the other thing to remember is what's called a living will. A living will allows for your health care wishes to be properly taken care of, so should you be unconscious, the family member or the power of attorney knows exactly what your wishes are and how you want the medical professionals to react. So if you have something like a DNR, which means do not resuscitate, and oftentimes that's what people have, a DNR, they know that the medical professionals are not to go to extreme measures to resuscitate you. It is your wishes not to go through that. So that's why it's very important. That's very clear in the healthcare power of attorney and healthcare will. And finally, the last thing that's good to remember is that families, at least some point near the latter stages of their life, visit an estate planner. An estate planner can help you make the proper decisions now while you're healthy and can make good decisions for how you want your estate to be settled, and they can help avoid probate, additional taxes, squabbles and quarrels amongst family members, and they can make the process of your estate very seamless and very smooth and ensure that the bulk of your assets goes to exactly the people that you intended it to. So we have just reviewed elder care options and how to pay for them, and I think you would agree that's a wealth of information and oftentimes very confusing and overwhelming. Care Patrol of Northeast Ohio is a free service that personalizes all this information I've reviewed specifically to your family members' needs and helps make what I've just said very simple and easy to understand and pertinent to your family member.
What Care Patrol does is we help families through this difficult situation. We help them find assisted living, independent living, memory care, or in-home care. We match them by location, their care needs, and how much they can afford. And then review the care violations of these communities. We want to find the safest care option. And then we set up tours, and we will actually take them to 3 or 4 different communities that would match what they're looking for, and we just walk them through the process. Once they find a community and they move in, we stay in contact with the family. We follow up and make sure they're happy where they've chosen. And best of all, we are a free service to the family. So how does Care Patrol work? What we'll do is we'll get a call from a family. Maybe they're looking for independent living. I got a call from a gentleman. I went over to his home and sat down with him to see what he was looking for so we could better match them for what they're looking for. Do they have a pet? We will only look for places that allow pets. Or maybe he was looking for independent living and he had some requirements. He wanted a dishwasher and a garbage disposal in his apartment. I said, great, that narrows our search down, and so it helps me better. We don't waste your time looking at places that aren't appropriate for you and what you're looking for. We'll get a call from someone looking for assisted living. Their mom or dad is in a split-level home. There's lots of stairs. They've fallen like 3 times. They're not safe in their home. And so what we do is, again, we will match them up with the correct assisted living community that's right for them. And, you know, we tell them that they have to get the feel of the community. You've seen one community, you've seen one community. You have to go on these tours and get the feel of that community and find what's best for your family. Some families like large communities, some families like small communities. We even have residential homes that are for seniors, and you get a lot more one-on-one attention in those homes. Another call we had gotten was from a family that was needing memory care. You know, what happens is maybe mom or dad has dementia or Alzheimer's. She had wandered out of her home over a busy street and then wandered down maybe a 1/4 mile and was in a church parking lot when someone found her and brought her home. What do? That's very scary. We found a secure memory care community for her so the family could be happy and know that she was safe and secure in where she was living. And then we got a call from a family that might be out of state. Their mom or dad still lives in Cleveland, but they've moved. And it's an overwhelming task. We walk them through the process and we'll set up the tours. We'll give them information through emails, find out what they're looking for. And then when they come into town to see mom or dad, we will take them on the tours. We'll take them to 2 or 3 different places that would match what they're looking for and walk them again through the process to find whatever they need.
You have just heard Priscilla explain Care Patrol and the free service Care Patrol provides to families. We've also reviewed elder care options and the challenges that families face. If you know of a loved one, a friend, neighbor, relative that could use Care Patrol's free services, please contact us.